Welcome to The Explainer. Today, we are diving deep into a medication that is seriously shaking things up in the treatment of type 2 diabetes and chronic weight management. It's called oral semaglutide. Now, for years, drugs like this only came in an injectable form, but now it's available as a daily pill. So hang on, a pill you take once a day that helps manage blood sugar and can lead to major weight loss? I mean, that sounds a little like science fiction, doesn't it? So what's actually going on here? How does the science make this possible? Let's get into it. All right, to really understand this, we're going to break it down into 5 key parts. First, we'll look at what makes this pill so revolutionary. Then we'll get into the nitty-gritty of how it actually works. After that, and this is super important, we'll cover the very strict rules for taking it correctly. Then we'll discuss the potential side effects and warnings. And finally, we'll touch on some key drug interactions you need to know about. So let's start with why this is such a huge deal. For the longest time, medications in this class, they're called GLP-1s, had to be injected. You see, the molecules are these fragile peptides, and they just couldn't survive the harsh environment of the human stomach. Oral semaglutide is the very first one where scientists cracked the code and successfully packed it into a tablet. So how does the pill really compare to the injections you've probably heard more about? Well, you've definitely heard of Ozempic and Wegovy, right? Those are the weekly injections. The pill version, which is branded as Rybelsus and now also Wegovy, is a daily thing. The absolute magic here is an ingredient called SNAC. Think of it like a tiny bodyguard that protects the semaglutide from stomach acid, letting it get absorbed. And while they're both used for diabetes and weight management, it is important to note that right now only the injectable versions are officially approved to reduce cardiovascular risk. Okay, let's get to the cool part, the science. How does this little pill actually do what it does inside your body? Well, it all boils down to copying a natural hormone that we all have. Semaglutide is what's known as a GLP-1 receptor agonist. I know, it's a mouthful, but the idea behind it is actually pretty straightforward. See, when you eat, your gut naturally releases a hormone called GLP-1. It's the signal that tells your pancreas, hey, time to make some insulin, and tells your brain, hey, we're getting full down here. This drug is basically a synthetic copy of that hormone, but with a superpower. It sticks around in your body for much, much longer than the natural stuff does. And the way it works is this really clever 3-pronged attack. First, it nudges your pancreas to release insulin, but only when your blood sugar is high, like after a meal. Second, it slows down how quickly your stomach empties. Now, this is a huge one, because it doesn't just help control blood sugar, it's also what makes you feel full for longer. And third, it works directly on your brain, targeting the areas that control your appetite and dialing down food cravings. It's a seriously powerful combination. Now, because we're talking about that fragile oral peptide we mentioned, getting it to work properly is all about following the rules. And believe me when I say these rules are very specific. First things first, you don't just jump in at the highest dose. It's a very careful, gradual process. You start out with a tiny 3 milligram dose for the first 30 days. And get this, that initial dose isn't really even for controlling your blood sugar. It's just to let your body get used to the medication. After that first month, you go up to 7 milligrams, and then, if your doctor says you need it, you might go up to the max dose of 14. This slow ramp-up is the key to minimizing the side effects we're about to talk about. And these next rules, well, they're completely non-negotiable if you want the pill to have any effect at all. You have to take it the second you wake up on a totally empty stomach. You swallow it whole with just a little bit of plain water, and we're talking no more than half a cup. Then you have to wait, at least 30 minutes before anything else. Food, your morning coffee, any other pills, passes your lips. If you don't follow this routine to a T, the medication just won't be absorbed correctly and it won't work. Okay, so we've talked about how it works. Now we have to talk about the other side of the coin, safety. Like any powerful medication, oral semaglutide comes with a list of potential side effects and some very serious warnings that are absolutely crucial to understand. The issues people report most often, by a long shot, are gastrointestinal, things like nausea and stomach pain. And really, that makes perfect sense, right? A drug designed to slow down your digestion is probably going to make its presence felt in your digestive system, especially when you're first getting started. This chart here puts some real numbers to that from the clinical trials. You can see nausea is the biggest one. It affects about 1 in 5 people on the highest dose, which is way more than the 6% of people who got a placebo. And you see similar jumps for things like stomach pain, diarrhea, and vomiting. Now, for most people, these side effects are pretty mild and tend to fade as their bodies adjust. But for some, they can be bad enough to make them stop taking the medicine. Now we need to talk about the most serious warning. This is what's called a boxed warning, which is the FDA's highest level of alert. Here's the deal. In studies on rodents, semaglutide caused a specific type of thyroid tumor. Now, we don't know if this happens in humans, but because of that risk, this medication is an absolute no-go for anyone who has a personal or family history of a specific rare type of thyroid cancer called medullary thyroid carcinoma, or another rare condition called MEN2. And beyond that big box warning, there are other serious risks that doctors watch for. Things like pancreatitis, which is a painful inflammation of the pancreas, acute kidney injury, which can happen if you get really dehydrated from severe vomiting or diarrhea. There's also a potential for worsening of eye problems in people with diabetes, and a risk of gallbladder issues like gallstones. These are definitely less common, but they're still really important to be aware of. Last but not least, let's look at how oral semaglutide plays with other common medications. Because it directly affects your stomach and digestion, it makes sense that it could also change how other drugs get absorbed into your system. One of the biggest interactions they found is with levothyroxine, a very common thyroid medication. Studies showed that taking it with oral semaglutide boosted the total amount of the thyroid hormone in the body by 33%. That's a huge jump. It means that if you're taking both, your doctor will likely need to monitor your thyroid levels much more closely to make sure your dosage is right. And there are a few other key ones to have on your radar. For people on the blood thinner warfarin, they may need more frequent monitoring. The effectiveness of oral birth control pills could be reduced. If you're already taking other diabetes meds like insulin, combining them with this one really increases the risk of your blood sugar dropping too low. And this last one is really interesting. It's called the volume effect. Basically, if you take the semaglutide pill at the exact same time as a bunch of other pills, its absorption can drop by over a third. It really drives home that rule about taking it all by itself. So all of this brings us to one big final question. We're seeing conditions like obesity and type 2 diabetes being treated more and more as long-term chronic diseases. Is a highly effective once-a-day pill that targets the root metabolic causes. Is this the future of how we approach daily medication and preventative health? It is an incredibly powerful new tool, and it definitely leaves us with a lot to think about.